Hey guys, my name is Dr. Joe Barnhart from Barnhart Dental in Vienna, and today I've got with me Kara Colmia, and she is our, we'll say, insurance guru, we'll say. There we go. Yeah, if you don't know all the answers right off the bat, you can find them out pretty quick. So one of the biggest things that we hear a lot is people don't know exactly what their insurances are going to cover or really what benefits they have, waiting periods, missing tooth clauses. Insurances are an extreme headache, even if you know what you're doing, let alone if that's not something that you work in most of the time, and frankly most people aren't. So today we wanted to go over a couple of things that might be kind of helpful to somebody who's looking to either get insurance or somebody who maybe has an insurance that doesn't know what they cover. So what we're going to look at is a few of the main things that people are kind of concerned about: implants, fillings, Invisalign, and what else do we have?
We have just all around care.
Yeah,
and then
general care, cleanings,
the difference between traditional implants and mini implants.
Gotcha. So what we want to do here today is go over our main priority is to make sure that everybody can get the care that they need as easily and as accessibly as possible, and we want to help and kind of hold your hand, so to speak, through the insurance process to maximize benefits so that you can get as much as you need done. It's a kind of a daunting process, so we really want to take and help you through that. So for implants, what would be some of the best insurances for that? If somebody's looking, if somebody doesn't have any insurance so far.
So the best one that I typically come across is Physicians Mutual. It covers a certain dollar amount of each procedure that you have done. So there are 3 different levels that you can purchase, and the top tier covers the implants. There are typically waiting periods involved, so sometimes you have to wait up to 12 months, which that's pretty standard for most of the insurances that you get as an individual. But Physicians Mutual is typically the top one for that.
Okay, gotcha. So that's for the, you said traditional implants?
That's for the mini implants traditional implants.
And one more thing, guys, we're going to go over an awful lot in the future is the difference between mini implants and traditional implants. That can, just implants alone can get extremely complex.
Yes.
So we'll go over what all that means. That way you'll have the proper education to know what to ask your insurance. At any time you can always contact our office as well, and we can, Miss Kara here will work with you to see what your insurance will do, what it'll cover, and how we can break things down to maximize your visit down here to us. Okay, so that's with the implants. What about ortho? What about Invisalign, which is mostly what we do here for orthodontics?
So the one I find that covers the most and typically covers different age ranges is Cigna, because a lot of insurances advertise that they cover ortho, but most of them don't cover over the age of 18. So making sure that your plan covers adult ortho, if you are an adult, is super important too. But Cigna is typically the top one for that.
Gotcha. Okay, so Cigna for that, and
Physicians Mutual for the
implants. Okay. All right. And what about for just general? Let's say somebody it's been a while since they've had a cleaning, or they are hearing from someplace and they just don't know what they need. They just need to start out by getting an exam and a cleaning and figuring out what's possible.
So Physicians Mutual is another good one for that. Also Aflac. A lot of people have heard of Aflac, and they offer different accidental and stuff, but they actually have a dental policy as well. And it's kind of the same thing where you have a certain dollar amount that they'll pay towards each procedure. So it's usually pretty cut and dry, and there's not a lot of variables in what they'll pay. We already know all of that up front. There are some waiting periods with that one as well, but like I said, that's pretty traditional with any kind of individual insurance.
What are some questions that people need to be asking if they're calling their insurance and they're trying to find out, like waiting periods, missing tooth clauses? Can you talk a little bit about those?
Yeah, so waiting periods. A lot of the insurances they'll advertise that your benefits are available upfront, ready to go as soon as you get it, and that's usually accurate for preventative care. A lot of the times your restorations, which are fillings, crowns, any of those, there's going to be a waiting period. Fillings and some simple extractions, it's usually about 3 months to 6 months. And then major work is usually your crowns, bridges, dentures, implants, those are going to be anywhere from 6 to 12 months. So that's something you'd want to know up front. That way, we don't do the procedure too soon and then the insurance doesn't cover it, which we try to check that as well, but it's always nice for you to know up front before you get the policy.
Yeah. And usually January 1st is a big time whenever insurances roll over, correct?
Most of them do. There are a few that will still pick up on your date. So if you enroll in June, it rolls over in June again. But the majority of the insurances have switched to a calendar year, so January to January.
Okay, gotcha. I'm certainly not an authority on this. That's why we have her here to go over this. And so we'll be in a room and we'll just say, oh, we got to talk to Kara. That's good. Okay. Anything else that you can think of? Things that you get, questions that you get, because you talk to people all day long about this type of stuff. Talk about some things that people ask you or some things that might be helpful.
So a lot of people think that if they have Delta per se, Delta insurance, they want to know what it covers. Not every policy through Delta is going to be the same. If you have a group policy, that's going to be different from the next person's group policy, or sometimes individual policies even, they'll have different levels. There's a few insurances that also, with each year, your insurance, it gets better. So just because you have one insurance and this person has that insurance doesn't mean you're always going to get the same policy. So it's definitely important to make sure you know more details than just the name of the company. And if you can print them out and see them apples to apples and compare them, that's always helpful.
Yeah.
Another thing is the missing tooth clause, of course. Mm. If you have a tooth missing prior to getting the insurance policy, a lot of them will not pay to fill it back in. So for instance, any gaps with the bridges or the dentures or even implants, sometimes you have to watch out for that.
Yeah. It doesn't mean we can't do it. It just means the insurance probably isn't going to be helping out. And that brings me to a little bit of a different topic as far as overall perspective of insurances. So I'll be honest with you, insurances are they're good at making money for themselves. They don't really help you, the consumer, that much. They really don't help us all that much. The reality is they are really good at making their money in the middle there. With that being said, it's definitely necessary. I mean, to not take insurance is not helping a large percentage of the population. So we want to make sure and utilize that. We want to maximize it too. For example, as we get to the end of the year, especially like November, December territory, people who have not used their benefits, a lot of times if they have bigger treatment plans, what we'll do is we'll do some things before the end of the year, and then we'll do some things after the first of the year. To maximize those treatment plans, to make sure that you get the most coverage. If you get $1,000 each year, you can take $1,000 toward your treatment before January 1 and $1,000 afterwards. So a lot of times if we're talking about implants, or if you just need a few fillings or whatever, a lot of times we can kind of help in that way. We also have lots of other different types of financing situations to help as well, even if insurance doesn't play any sort of a part. In fact, Clear is one thing that we use. It's an in-house insurance, so to speak. And what that does is, in fact, you should probably explain that because you know it far better than I do.
So it works kind of like an insurance company. However, it's just all in-house. So there's no clauses, there's no waiting periods. We've taken out all the complicated stuff that's involved with insurance. Each year you receive your checkups and cleanings, your x-rays, any of your preventative care is covered 100%. You're also allowed an emergency visit with an x-ray once a year. That's free. And then you receive 10% off of all other procedures in our office. So a lot of people who don't have insurance really like the plan because the monthly premiums are low and you get the same benefits you would from an insurance.
Yeah, and most insurances cap out. So anyway, they cap out.
They cap out at 1,000 or 1,500. Mm-hmm. Yeah.
So if you need a mouth full of work and you're wanting to save a lot more than 1,000 or 1,500 a year, a lot of times this plan is going to save you dramatically more.
Right.
Because you could save a lot more than that, and that's really what we want. I think that's a good investment to get to the point where we can start to really fix some of the bigger issues. So. Yep. Very good, very good. Well, that's about all we have for our insurance section today. I'm sure we'll think of like 30 different things as soon as we get done here today.
Yeah, exactly.
Yeah, that's all right. Maybe we'll do another one. Anyway, all right. Thanks for stopping by, and we'll see you guys next time. Oh, one more thing is that it certainly does help if you can subscribe to our channel. We're going to be doing weekly videos, so that certainly helps. And if you can always call it 573-422-3612. Go to barnhartdental.com, and we'd be glad to help, ask questions. Yeah, help you any way we can. Talk to you next time.